About this monitor, this is the Multipara monitor. It is having multiple parameters. So first of all we have to see whether there is any alarm. So alarm can be of two types. One is the visual alarm, another can be the high priority alarms. Okay, so you have to check why this alarm is there and you should address the alarm. Now coming to the first parameter, that is the ECG. So this you can see, this is the visual alarm, right? So if such alarm comes, then you have to first of all see this alarm is coming because of this is the respiratory rate which is high. Okay, so you have to address this first of all. So now this visual alarms is goes away. Now first we are taking on the ECG. So ECG you can see two things. One is the ECG trace, another is number, that is the heart rate. So in ECG there are the P, Q, RS and T pattern, and you have to check whether this is regular or irregular. So you have to check that. Second parameter is your SpO2. So here is the value, numerical value. You can see 19, this is SpO2 and the trace is beautiful. Now coming to the another parameter, that is the invasive arterial line. So invasive arterial pressures. So whenever you check this, you should ensure that your transducer is at the correct level, that is the phlebistostatic axis. In invasive pressures there is a one is arterial pressure, second is the central venous pressure, third is your intra-abdominal pressure, and fourth is your intracranial pressures. So that can be monitored. In every case you have to make sure that you are having the transducer at the appropriate place. Third parameter is this. Fourth is the respiratory rate. So whenever our patient is on ventilator, we do not keep it, otherwise we see this. After that there is the EtCO2. So in EtCO2, that tells you the trace and the numerical value. So you have to check that numerical value as well as you have to check the trace. Normal trace is your square pattern. If that square pattern is changes like this, so that shows the cobra hood like the pattern. So that shows the respiratory, that is the bronchospasm. So that can be taken care of with the help of your nebulizations. So these are the parameters which we see. Another parameter can be your temperature, or additional parameter can be your non-invasive pressures. So non-invasive pressure you have numerical values and diastolic and systolic pressures, and temperature you have this. So these are the parameters. This Multipara monitor you will see in almost every ICU, and this is very important because it gives you the vital well-being of the patients and multiple parameters. So this is the, you should take care of. Suppose your suppose say how to address the alarms. So suppose your alarm is because of this SpO2. So now you can change the upper limit or lower limit. Like if your upper limit like I can change lower limit, like this is, I want to make it 80. Okay, or I can change the upper limit to little high. So in this case, so that is the way you should address your alarms. Okay, I think this is all about what I wanted to tell you. But make sure that your alarm should be addressed and this should be taken care of. Alarm should not be neglected in any case. Okay, thank you very much. Thanks for watching the video. Thanks.